Hello, everyone. Thank you all. I do apologize. My mouth is still a little dry, but today is the last day of Ramadan. So going forward, I will no longer have the excuse of having a parched mouth to speak. So thank you all for coming out to a little scrum, and I'll open it up to questions. I think you have some.
What did you take on Chamber? Is that just some MLS listings?
Yeah.
Tax dollars?
Yeah, so great question. Yeah, so I tabled a whole bunch of documents in the House today to really show Manitobans that what the NDP are saying is not reality. It's not facts. The facts clearly show, based on just an average MLS listing, that Manitoban middle class will be paying more in education property taxes this year. Those are facts. So I tabled houses. I tabled houses in Lagimodiere, in Waverley, in Southdale, in River Heights, throughout Winnipeg, and throughout Manitoba, actually, that their education property taxes will be going up based on the average price of a house here in Manitoba. And I have those documents as well I can share with you for the MLS listings. I mean, Manitobans need to be really clear that this education property tax is costing the average Manitoban $148 million. On page 122 of the budget document, which the minister refuses to acknowledge in his own document, clearly says $148 million increase in education property taxes. That's concerning, on top of the fact that every year the education tax will continue to rise, as the NDP have decreased funding and opened it up for the school boards to increase the taxes, and we've seen hikes as high as 17% in the first year. This is really concerning for average Manitobans, and I think it's important to acknowledge that this minister and this premier will refuse to even answer the question.
What's the cutoff that you're using? Because in the budget, as you noted, the mill rate is an average, but it's 2 years old. What cutoffs are you using in the documents that you have that show that these homes for sure will be?
Yeah, so a really simple calculation, Ian, and you're right, the mill rate's always going to change, and they use the mill rate in the document from 2023. This comes into effect 2025, so it's hard with the mill rate. That is going to go up. If you look at certain school divisions, like Winnipeg School Division has a higher mill rate than what's in the document. What I used off of was very simple math to keep it easy. If your education tax is $2,300 or higher, you are going to be paying more under this. So if you did the math, 50% of $2,300 plus the $350 rebate, which was under the PC government, you're getting $1,500 back. And as that goes higher, $2,400, $2,500, $3,000, $4,000, some people, you're getting more back under the PC plan. Under the NDP, no, you're paying more taxes. And that's concerning, because if you look at a house here, $403,000 is paying $2,600 in education taxes. So right there, that house in Royalwood is paying more under this NDP plan. That is very concerning, being how the narrative from this minister and this premier has been not based in reality or facts. Manitobans are paying more, $148 million more. For the average, I mean, and again, these houses, and I do appreciate that these houses are still, in the mid 300 and above range, and that is very expensive for some Manitobans. But that is also a lot of middle class Manitobans. $350,000 and above, you're paying more taxes under the NDP. Plain and simple. And that is what I tabled, and I will continue to table documents until we get a clear answer from this minister and this premier on why they are waging war on the middle class in Manitoba.
I guess what do you say? And you noted that for some Manitobans they can't afford that.
Yeah.
What do you say to those that don't have that type of money, that they're like, why should I worry about someone making having a 350 or 400K home?
Yeah.
Why should I worry about it?
And that's a great question, and I really appreciate that, and I respect that. Having a $350,000 or above home is not for all Manitobans. And as a government, because we're not in government, we're opposition. The government needs to take that into effect. That how can they make life more affordable for people that are not in that range, and how do they not penalize Manitobans for being in that range? And right now, this seems like a penalty on middle-class Manitobans. Government needs to take an all approach. They need to help everybody. And people that aren't in that range, of course, there needs to be affordability measures on that under the previous government. You see the advertising done everywhere by this NDP. Billboards are up across the province. And what are they announcing? They're announcing the best thing in the budget, and that's the average Manitoban will save $4,000 to $5,000. Well, who did that? That was the previous PC government. This government has done nothing to address affordability measures for Manitobans. This one may have helped people in the range that were below this, but everyone above it, you're paying $148 million more. And that is driving up cost of living. It's making life more unaffordable for Manitobans. It's not what government should do. They are not taking the whole of Manitoba approach. They're picking winners and losers, as we've said. One other thing I will add to that, you want to talk about the gas tax stunt that this government has done. Well, based on the numbers off of these houses and higher houses, $400,000, $500,000 range and above, whatever the offset was going to be in savings is from the gas tax is far less than what they're going to be paying on this education property tax. And Manitobans need to be reminded of that. This NDP is playing with smoke and mirrors and pulling the eyes over Manitobans when in reality, they are making the cost of living in Manitoba more expensive. All right, on that note, if there's no more questions in regards to this, I do have these. If you guys wanted copies of these, I can leave them here, or you can take pictures of them, I guess. I'll give them to the media here. Thank you very much. I'll now pass the podium over to my colleague, Kathleen Cook.
Thanks, Obby. I'll just summarize what I raised in the House in question period today, and then I'm happy to take any questions that you have. So the NDP has not been clear about the status of many of the agreements that were signed previously to increase surgical and diagnostic capacity in Manitoba. In the House, they say that they've spoken with the organizations involved, but just this morning, another facility reached out to me and the minister both and said they haven't heard anything about their expired contract from the NDP. Of their own accord, this facility recruited 7 sonographers to Manitoba that are now potentially being poached by Alberta. That much needed staff and much needed capacity in our system may leave due to NDP negligence. We know that there were other facilities providing additional capacity under these agreements, and the minister has not yet been transparent about the status of those agreements. Manitobans need to know the truth. I'm happy to take any questions you have.
Which clinic are you referring to?
I would love to tell you. I don't have permission from the clinic owner to share that publicly. If I get that permission, you'll be the first to know. I suspect that the clinic owner may fear retribution from the government for speaking publicly. After all, they still do want to do business with the government.
The health minister seemed to indicate that the agreements were still in place. They aren't signed, but they're carrying on. The diagnostics can continue as per this agreement. I don't know, did the clinic that you were talking to indicate there was some sort of unspoken or unwritten agreement, spoken agreement, unwritten agreement about that?
No, and in fact, quite the opposite. This clinic owner reached out to the province at the beginning of March in correspondence that I wasn't initially copied on, but they shared it with me today, and they've heard nothing from the minister. They requested a meeting. They wanted to know about the status of their contract going forward as it was set to expire on March 31st. So if there's an informal agreement, I think it's fair to say this particular clinic is not aware of it.
Have they done anything to your knowledge?
No, as I understand it, as their agreement expired on March 31st, they'd be unable to continue billing Manitoba Health for those procedures.
So they've stopped.
That's my understanding, yes.
And the 7 sonographers are sitting around looking for something to do. I don't know if they're here.
And they're being actively recruited by facilities in Alberta. The clinic owner indicated that facilities in Alberta have offered multi-year contracts to those individuals. And as the status of their employment here in Manitoba is really dependent on the status of this agreement, we could be losing those staff. If the minister doesn't have any indication of renewing the agreement, they should at least be reaching out to the staff and trying to employ them in the public system. Any other questions?
I guess, I think sorry, in the press a couple of days ago, I think the minister said that they are in the process of reaching out to these facilities. I mean, that says that at least for one clinic they haven't.
That was my understanding too, and that's why I was so surprised to receive that correspondence this morning indicating that this clinic at least has heard nothing. And now keep in mind, these contracts, this contract and the other one that I referenced last week expired on March 31st. I suspect a great number of those contracts probably expired on March 31st because it was the end of fiscal. It's actually quite negligent and irresponsible of the government to leave these clinics hanging and to leave Manitoba patients hanging for this long. I don't buy the excuse that they needed to wait for the budget to be released. That budget had more leaks than the Titanic. They could have leaked this detail, they chose not to. They're leaving clinic owners and Manitobans wondering about the status of these important contracts that are needed to increase surgical and diagnostic capacity in Manitoba. And now we're seeing wait times go up and staff potentially leaving.
And the correspondence you're referring to is an email that you received today that's dated today?
Yes.
And it was sent to yourself?
And to the Minister of Health. So there should be no surprise to the Minister about this. This was not a gotcha. And again, if I get permission to share that with you, I'll be happy to do that. Okay, thank you very much.